Senator Clinton, is too much of the federal budget going to entitlements? Too much of the federal budget? I mean, so how do we change entitlements for the future so we keep the promises made to Americans living today? And if it's not a problem in your view, tell us why not. 1 minute, please.
Well, it is a problem. It's a particular problem with Medicare, where we have a very immediate set of challenges. It's a longer-term problem with Social Security. We have to deal with both. Part of that is getting back to fiscal responsibility. Part of it is reforming government programs. You know, Medicare is especially vulnerable because the costs are going up so quickly. That's why we do need to give Medicare the right to negotiate for lower drug prices with the drug companies. That's why we need to rein in the excess payments to the HMOs. They're getting paid $1,000 more per patient than what your doctor would get just being on a personal relationship with you. We've got to have a health care reform like the one that I have proposed, the American Health Choices Plan, that will bring costs down. I have very aggressive cost reduction measures. That will help Medicare. And with respect to Social Security, I think that the best way we're going to deal with the long-term challenges is when I'm president to convene a bipartisan commission, because Republicans and Democrats are going to have to agree to make the changes that are necessary.
Thank you. Senator Biden, would you answer that too for 1 minute?
Yes. Entitlements will be a problem if we don't act. But the solutions are within our capacity. Social Security is an entitlement program. By lifting the cap on Social Security, it'll be solvent as long as any young person in this auditorium, no matter how young they are, number one. Number two, Hillary touched the points about Medicare. Medicare, in fact, it's cost. It's not new benefits, it's cost. And the whole idea there is that the combination of the $10 billion we're overpaying HMOs a year, the combination of prescription drug costs being able to be negotiated by the federal government for Medicare, and the combination of modernizing the system so you deal with chronic disease and others, which it's estimated we could save over $100 billion a year in Medicare if we made all these modernizations and changes. So it is within our capability to do it. The question is, you got to act. And this is all about action. And I think they're totally within our capacity to do both of those things.
I'm going to let Senator Obama and Governor Richardson answer this. 30 seconds, please, and then we need to move on.
Well, just to emphasize how important prevention and cost savings can be in the Medicare system. It's estimated if we went back to the obesity rates that existed in 1980, that would save the Medicare system $1 trillion. So many of the reforms that I've suggested in my health care plan will reduce costs, not just for the overall system, but also for Medicare. But one thing I have to say, we are not going to make some of these changes unless we change how business is done in Washington. The reason that we can't negotiate for prescription drugs under the Medicare prescription drug plan is because the drug companies specifically sought and obtained a provision in that bill that prevented us from doing it.
Thank you.
And unless we change that politics, we're going to continue to see the waste that we're seeing in the entitlement programs. Governor?
I believe universal health care is a human right for every American. And 1/3 of all of our health care budget, $2.2 trillion, 1/3 of that goes to administration and bureaucracy, failure to have electronic records. That has to shift to direct care. But prevention is going to be the key. You mentioned Medicare. 33% of Medicare costs are today related to diabetes. We got to have an elimination, as I did in New Mexico, of junk food in schools. We need to have mandatory phys ed. We have to be a country that does more research on stem cell research, on autism, on heart disease, on chronic diseases, on cancer. We spend $6 billion of cancer this year, in 1 year. That's 2 weeks of the Iraq War. That shows the misguided priorities that we have in this country.
Thank you, Governor.